Yeah, let's get going. So thanks everybody. My name is Dion Filmer from the research department. Just want to welcome everybody here today for this joint session organized by us here in the research department and the HD Chief Economist Office. We have Fuhito Kojima from the University of Tokyo, who's going to talk to us a little bit about how we can use market design to get to more efficient and more effective outcomes. The session is going to be chaired by Norbert Schady, who's the incoming, newly started chief economist of the Human Development Network. So we're going to have, after Fuhito's presentation, we'll have some discussants. I think Norbert will tell you a little bit more about who the discussants are. So with that, let me turn it over to Norbert.
Thanks, Dion, and thanks to everybody for joining us this early in the morning, at least for those of us here in DC and elsewhere in the US. As Dion said, we're going to have a presentation by Fuhito on a particularly timely topic, namely COVID-19 vaccine design and matching strategies. I encourage the audience, everybody in the audience, to share their comments and questions in the chat box at any time during the talk, both on WebEx and on YouTube. We will address them at the end of the seminar. I also want to remind everybody or those participants connected on WebEx to please make sure that you remain muted so as not to disturb speakers during the seminar. And the seminar is being recorded. So without further ado, thank you, Fuhito, and over to you.
Wonderful. Thank you so much. Thanks again for joining the seminar very early in the morning for some people. And thanks again for this really nice setting. Okay, so I'm a microeconomist, and so why am I here? So I have been really interested in studying some matching problems. But not only in the abstract, but also in the sort of practice. So I understand that in this audience, there are a lot of researchers, but also some people who are more practice oriented. So I would like to try to balance that sort of like research aspect of my talk, but also how I think that could be useful for implementation. So let's see if I succeed or not. So I greatly appreciate your feedback. Okay, on that note, let me talk about the content. Oh, just a little bit about myself. So hi, I'm Fuhito Kojima. So I'm an economist at the University of Tokyo. So I used to be in the US actually until late last year. So I was teaching at Stanford. But then last year, December, over the last year, I moved to Tokyo. And the reason was mostly my personal reasons, the dual career issues, which by the way is an interesting matching program. Anyway, so my wife and I moved to Japan with my kids. That also gave me some chance to do something else, actually, which is to put my theory, microeconomics theory and market design theory in particular into practice. So how? Well, firstly, the University of Tokyo helped me establish a new research center in the university called the University of Tokyo Market Design Center. So that's a research center there. And another thing I began to do upon arrival in Tokyo is I joined a company called U Tokyo Economic Consulting. So that's UT Econ for short. Indeed, the way I got this opportunity to talk in front of you today was through this company. So someone in the company talked with someone in the bank and connected me to you. So today I would like to talk mostly about some implementation related projects that I'm doing with this company. Okay. So let me talk just a little bit about what this company does, and that's kind of related to why I'm here. So this is again a company basically established by the university, and faculty members in University of Tokyo, like myself, works on a project basis, and as well as some people from other universities. And it also has a bunch of full-time analysts with economics background. And as you can see in the slides, so this company itself covers a variety of areas, okay? Things like marketing and finance. But given that I'm a microeconomist studying the market design issues, so my interaction with the company is on this market design project, right? Okay, so what kind of project am I working on? So I have been mostly working on things like matching doctors and hospitals, which is a very traditional issues in market design and marketing theory. So recently I have been thinking about some other applications, and actually one of the reasons that I wanted to talk today is I'm really interested in learning from you whether there are good applications of the theory as applied to, especially to developing economies. Okay, that's the and so I'm aware that the application in developing economies may pose different challenges than, let's say, the medical match in the US, okay, which is a very traditional topic in market design. There may be some problem in enforcement by the authority, or the kind of information you could expect to get may be different in different applications and so on. So today I'd like to mostly talk about the issues I have been working on, but I'm also very interested in learning from you whether some of the insights I got from my research could be translated into these applications, right? Okay. But in order to do that, I need to talk about what I do. Okay, so unfortunately, I do not think that I have enough time to cover all of the practical projects that I'm working on. So let me briefly talk about a few of them before going into some specifics. Okay. The first one I'd like to mention, and I understand some of you could be interested in it, given what you have been doing. So the first topic is the seat allocation in child care centers, like daycares or nursery schools. So this is the specific institution is Japanese daycare allocation program. In that context, there's the local government is in charge of allocating seats in daycare centers. Okay, and essentially the daycare centers are running certain matching algorithm to allocate seats to applicants, right? So not the prices are kind of set at the regulated rates, so there's no market clearing here. So instead, they collect information about preferences from the parents of the small kids, and then the mechanism or algorithm decides who gets which seat. Okay, and it turns out that there's some inefficiency in the existing mechanisms. So I have a paper, which I will not have a chance to talk much about today. I have a paper, though, which sort of points out how to improve upon the existing mechanisms. And now I'm working with a government contractor, which provides the software and other assistance to the local government. And we are in the stage of evaluating the effect of suggested change. Okay, so I am really interested in this kind of work, namely to use some theory to see if that can be applied to real world applications. So 3 other things I'm working on: mass vaccination, obviously for COVID-19, and improving geographical distribution of medical doctors and other kinds of healthcare workers. And another project is to how to match employees to different divisions in the firm or other organizations. Okay, so I will actually talk about each of them at least a little bit in the remainder of this talk. Okay, so so that was a somewhat longish introduction, I guess. So let me go into the actual content. Okay, so I'm sure that most of you are familiar with the market design as a field in economics, but let me just make sure that everybody is on the same page. Just have one slide to talk about what is this matching theory and market design. So matching theory is the sort of theory of deciding who gets what, okay, how to match small kids to daycare centers, or how to match the vaccination slot to the recipients, for example. And we would like to, we typically put ourselves in the shoes of the matchmaker, i.e., well, maybe local government in the child care center allocations, or the hospital network in the vaccination. Okay, and we like to achieve some efficiency and perhaps with other constraints, such as we cannot use money, we need to use allocation mechanism that is fair in a certain sense. Okay, and in addition, there may be some other considerations like constraints. For example, in the case of vaccination, there may be a constraint coming from the vial size, i.e., once you open the box, you should use all of them. Okay, and where the freezing facility is in order to keep the vaccines in the relevant place. Okay, and of course, we need to think about incentives of people participating in this kind of program. In the case of nursery school or daycare allocation, you should make sure that the parents have incentives to report true preferences to the matchmaker, the local government, so that the government can sort of like rely on the submitted information to decide what is the optimal allocation. Similarly for the vaccination campaign as well. Okay, so this is the perhaps too short description of the market design. So let me talk about something more specific now. Okay, so the first topic I'd like to spend some time on is related to healthcare, but not quite on the COVID actually. So this is mostly coming from my earlier work. Okay, here's what the conversation I had with an employee in the World Bank some time ago. So she was working on the healthcare in the African region. So she was telling me that, hey, there's a big imbalance of healthcare workers in the region that she was working on. And especially, there's a huge shortage in midwives in certain areas in her country that she was working on. So the problem is that the total number of midwives in the country is so-so, but many midwives are concentrated in the capital, while in the rural areas there's a huge shortage. Okay, and so that got me very interested in this problem of how to balance the distribution of midwives in the geographical sense. And obviously, this imbalance of midwives and the nurses is not a problem limited to African continent, obviously. So here is a map for India. So depicting the distribution density of the midwives population in different regions. And as you can see, there's a big heterogeneity here. Okay, so I have not had enough chance to understand all the institutional details of the midwives in Africa or India yet. So incidentally, I would like to learn about it from you. So, however, this general issue of geographical imbalance of healthcare workers is a very common problem, not only in developing countries, but also in, well, many other countries. So I happen to have worked on this particular issues in the context of medical residents in Japan. Okay, so like I said, the medical residency matching is a very, very traditional application of market design. And so, for example, in the US, the algorithm-based matching system to match medical residents to hospitals has been used for about 70 years, pretty successfully, I would say. And basically, that's based on the very well-known algorithm called the deferred acceptance algorithm by Gale and Shapley. And this was a big success, and it has spread to many other countries in the world. And Japan is one of these countries which adopted the US-style matching algorithm, although quite late, namely in 2003. Okay. However, in this context of Japanese medical match, here's a problem. When the government introduced this matching algorithm-based matching system to match medical residents, there's a complaint which says, well, too many doctors or medical residents are now concentrated on some regions like Tokyo and Osaka, which are big urban areas. Okay, and at the expense of rural areas. And basically, the matching system is causing a lot of shortage of doctors in some areas. Okay, and so that is really sort of isomorphic problem to the imbalance of midwives that I mentioned in other countries. What is interesting in this particular anecdote is that the Japanese government introduced a regulation to cope with this problem, and which I call the regional cap constraint. So what is a regional cap constraint? So Japan has 47 prefectures, so think of it as different regions. And for each region, the government sets a upper bound of the medical residents who can be placed. Okay, so for example, when the regulation was enacted in 2009, there were about 15 to 1,600 doctors in Tokyo. New doctors in Tokyo, but the regulation said, well, now the regional cap will say that you can put only 1,300 doctors in the region, and similar to other regions. Okay, so that's the regulation, and now the problem is how to implement this regulation. Okay, so because there's an algorithm and the existing algorithm does not honor this regional cap constraints, so we need to one needs to make a modification to the algorithm. And in the Japanese case, and it turns out that similar modification has been done in other contexts by other countries. The way to cope with it is to basically force each hospital in the country to only have smaller capacities than what actually physically capable of, in such a way that the regional cap constraint will be satisfied, okay, automatically, but that turns out to be inefficient. Okay, so so we observed this problem with existing mechanism in this paper I wrote 2015 with Yuichiro Kamada in UC Berkeley, and so we showed that there's a way to improve upon the existing mechanisms. Okay, namely by tweaking with the algorithm in a little bit smarter manner, we can make every doctor to be made better off compared to the existing mechanism. Okay, and also, in fact, achieves the constraint efficiency, i.e., there's no way to Pareto improve everybody as long as you are still the matching is still honoring the regional cap constraints. Okay. So okay. So here's the detail of the mechanism. I don't think it's useful to describe every aspect of this matching system, but let me just describe it a little bit. So as in many matching mechanisms, you need an input, which is, well, let me describe everything in terms of the midwives, just to make it sort of relevant. Each midwife reports a preference ranking over the employers, and employers reports a preference ranking over the possible midwives. Okay, and then given that information, there's a computer running the following algorithm. Begin with a situation with nobody is matched, and then in the first step of the algorithm, every midwife applies to the her top choice. Of course, this application is not made in real time, but done by the computer on behalf of the midwives. Now, if you are familiar with the Gale-Shapley's algorithm, what it does is, well, now each employer gets applications, and among them, choose and keep all the best ranking midwives up to its capacity. Okay, and then rejected midwives will apply to their second choices and so on. So this is going to be, this is a standard mechanism. But now, given that there's a regional cap, i.e. the upper bound of the number of entire midwives in the region, we add one supplemental part phase in this algorithm, which is if the regional cap is violated, then use some exogenous order and force each employer to reject additional midwives from the applicants. Okay, until the regional cap becomes satisfied. Okay, okay. So that is the algorithm. Okay, right. So here's an example. I don't think it will be too useful to look at all aspects of the algorithm, but but then like in the standard mechanism, everybody applies to their first choice. In this case, there are 8 midwives, and hospitals tentatively keep the best ranking doctors, which I circled with red here, and reject some worse ranking applicants, in which case, in this case, 7 and 8 in this example, and rejected doctors apply to their second choice, and so on, right? Okay. So for the purpose of today's talk, let me show, however, our simulation results. Okay. So theoretically, we can show that this new mechanism can be useful in the sense of improving up on the existing mechanism. Okay, which is again to set a smaller capacity than the physical capacity and run the existing mechanism. Okay, here's a simulation based on the simulated data, but with the information coming from the publicly available data from the Japanese medical match. And 3 columns correspond to different mechanisms. The leftmost one is the case without constraints, i.e. there's no regional cap constraint. The second one is our new mechanism. And the last one is the existing mechanism, as is used in Japan and in other countries currently. And these blue and oranges and so on correspond to the first choice of the number of doctors matched to first choice and the second choice, and so on. And these gray areas correspond to the number of unmatched doctors. As you can see, compared to the case without constraints, pretty much both mechanisms in this case, and pretty much any mechanism will be less efficient for the obvious reason. However, among the mechanisms that have constraints, if you compare the existing mechanism and the new mechanism, there's an improvement in the matching. So, for example, the number of unmatched doctors proportion actually is something just below 20% in the existing mechanism, and that will shrink to something like 12%. All right. Okay. So this is actually hypothetical data. So should we believe anything like this? And is it actually implementable? So unfortunately, I have been talking with the medical match organizers in Japan, and I have been unsuccessful in persuading them to use this mechanism. However, there's another context in which I have been able to use it. So this is a case of a Sysmex. So this is a major medical equipment company in Japan, and we helped them match their new employees into different divisions of the company. So that happened in April. And when we did it, we find a particular issue, which is actually interesting. So they had common upper bound on the over the capacity of the group of divisions. So, for example, as a medical equipment company, they had a research center, and there were a bunch of different groups working on different topics. And each group, each division in this within this research institute had its own capacity. Let's say three research divisions, each with capacity of three to take care of the new employees, but the entire research center has its own capacity of 5, for example. It turns out that this is mathematically isomorphic to regional cap, right? So each division is isomorphic to hospital, and a group of hospitals, like this research institute, is isomorphic to the region. So we managed to, we were able to implement a new mechanism. And indeed, well, while I'm not allowed to speak too much about the detail, but we did get improvement in allocation. So for example, compared to the existing mechanism, we put 20% more people, employees, to their first choice, for example. All right. Okay. So okay. So that is the one of the matching mechanisms that I suspect might be useful in healthcare issues, right? Okay. Let me switch gears and talk briefly about the COVID-19 vaccines. All right. So this part is not based on published paper yet. So I have been mostly working on a more sort of consulting basis. Okay. So I'm still thinking about how to make sense of everything I have learned in this experience. Let me share my progress report, however. And so one of the things I want to say is that my impression is that many different countries have, well, vastly different experience, although there's some common thread. So in the US, it appears to me that the main issue for vaccine allocation now is how to incentivize the people to get vaccinated. Well, unfortunately, in Japan, we are still in the very early stage of vaccination, and the problem is still very different. Well, it's kind of similar to the maybe 4 months ago in the US. The vaccination to the elderly began mostly last month, and still in the early stage. The big problem now is a congestion of reservations. Okay. And that is, well, people try to make reservations, and that leads to the shutdown of the system, reservation systems all the time. And so that happens for the reservation websites, that happens to the call center and telephone lines. And also it happens the reservation assistance by local governments. So being the stage being for the vaccinating the elderly, a lot of elderly people need actually hands-on assistance by the real person in places like City Hall in order to actually make a reservation. As it turns out, this picture on the right actually shows that, well, there are a lot of people actually lining up to get this very assistance, okay, in the City Hall. And obviously, this is really bad thing to happen, right? So people are close by, and this picture is still kind of civilized, but in some other cases, there was almost like, close to being a riot. So for unhappy people who cannot make a reservation and so on. All right. And this picture is from the call centers. So obviously the call center has very little capacity, so you cannot make a lot of phone call go through, right? Okay. I'm pretty sure that similar experience happened in various parts of the world. So what is the problem with this congestion of reservations? Well, at one level, this is a simple matter of excess demand, right? So in the beginning, supply of vaccination slot may be limited, and there are a lot of people who want to make reservations. But another aspect of it is actually that's a failure of the reservation system, right? Okay, so what is the problem with the reservation system as used in most places in Japan currently? So this reservation management is done by the municipal level, so local governments. Most places use the first come, first served system. Namely, the government says, okay, we begin taking calls and opening up the reservation website at, let's say, 9 a.m. on May 10th. Okay. Then what happens? Well, of course, everybody begin to call at exactly 9 a.m. Why? Well, they want to get a reservation spot earlier than others, and given that everybody is trying to do it, there's even more reason for you to just make a phone call a little bit faster than everybody else. So that's a sort of problem that will basically cause everybody to make excessively many phone calls. All right. So the same for the websites. So what can we do to help solve this problem? Some interventions are possible. So depending on what you can do logistically. So ideally, one way to solve this problem sort of once and for all would be to use a matching system, like the one I mentioned earlier today, right? So the recipients could enter preference ranking over the slots, i.e. date, time, and the location using the websites. And then they could match people to the available slots. Okay, so we recommended this to some local governments, and unfortunately they could not do it. Well, why? Well, by the time we had contact with them, they have already chosen a contractor and providing the reservation system, and they already decided how to do it. Okay, given that, is there anything else one can do? It turns out that there are some other things that can at least help somewhat. Okay, and here's the thing: in one of the municipal government we worked with, they can still decide who can enter the reservation system. Okay, and then so that means, by limiting who can make reservation at day 1 and day 2 and day 3, essentially we can kill these incentives for for making a phone call earlier than others, right? So specifically, the criterion we managed to use is age, right? So given that the older people are more prone, so it was kind of like consistent with the fairness notion that the people seem to have. So basically, we can say in day 1, the people 75 and older could make a phone call. In day 2, people with 73 to 75 could make a phone call, and so on and so on. Okay, so that turns out to be actually feasible, even under a lot of constraint in terms of what can be done for the system, right? So I'm kind of saying that to emphasize this aspect that one can sort of like be a little bit kind of like non-perfectionist and do what you can in a sense. And so this kind of thing has been done in the Japanese context, and one particular city who are happy to disclose that we are working with is a Chiyoda city in Japan. So this is a kind of interesting city where all the parliament and government agencies are around. And so like many cities in Japan, they have lots of constraints on what they can do. But then so we have been able to advise on some aspects of their reservation system. Okay, and okay, so so this part was a little bit like eclectic, I think. There are some underlying theory that we can discuss, but I think I'm more or less out of time. So let me just skip some of the details of the matching theory behind it, and just finish with this slide. So I wanted to sort of emphasize both some theoretical work I did in terms of medical match, and also some newer consulting type work, which I believe is possibly useful. And so on that note, let me just stop talking. Thank you so much for listening.
Thank you, Fuhito. That was very interesting. I'm sure there'll be lots of interesting discussion. So we now turn to Feng Zhao, who's the practice manager in health, nutrition, and population, to see how he thinks this experience with different matching mechanisms and algorithms can be useful for the work that we as the World Bank do in, as I said, health, nutrition, and population. Thank you, and the floor is yours, Feng.
Thank you, Norbert. I'm really looking forward working with you in your new capacity as the HD chief economist. And Dion, I remember our last travel together was to Japan with the HD team. I was in African Development Bank at the site of a major African conference. So it's good to come back listening from Professor Fuhito Kojima and make a connection again with the Japanese academic institution. And Professor Kojima, I have to tell you a story. My last mission before the pandemic was to Tokyo. Of course, we were in the context of discussing with the government as our major donor to financing universal health coverage. But I took time, did something quite different. We organized a consultation with the academic institute on our HMP strategy. Really consult with the top brains in the health system side to get their input. That's turns out to be one of the best meetings I ever had. We have 10 professors from different universities. One professor traveled for hours to come to Tokyo just for this meeting, and after meeting just went back to his university. So it was quite a touching and interesting experience. Let me touch on a few things you have mentioned. I have to say this is one meeting I come in both excited and don't know what I need to say because it's such a new topic, very exciting topic. Let me maybe quickly touch on a few points what we're working on and how we make that connection. The bank has taken unprecedented response to COVID pandemic in pretty much in two phases, if I make it simply. The first phase is really the emergency operation, which will have 6 billion. With the main support is really on essential supplies, trainings. That's mostly, from March last year to the summer of last year. In a short time, within 100 days, we have reached over 100 countries. That's really unprecedented speed in the bank's history. And also currently we have a 12 billion package to support vaccine and vaccination program. So far we have about close to 30 countries project has been approved. We have a strong pipeline. Over $2 billion has been committed. So that's it's ongoing. One thing we learned from this two phase of response is there's a significant market failure from the get-go, and also mismatch between supply and demand. During the first phase, and everybody is scrambling for essential supplies, ventilators, masks, but the market was broken, and you really have to go out your way to do those, to secure those supplies, even you have financing. So for the first time, which is unprecedented in the bank, in addition to provide financing, we established something called bank facilitated procurement, which we getting into the big business of matching supply, matching manufacturers and the countries, make sure, with the bank financing, but they also can transfer financing into essential materials. So that's one example, which really reflect on the type of work you are doing as the issue we want to address. And during the first phase, we also realized risk communication and public engagement is such a critical way of addressing COVID-19. So really understand the demand side factors, communicate clearly about science and evidence, and also encourage healthy behaviors, particularly before we have the vaccine and other effective tools, is such a critical part of the response. In the second phase, in the current vaccine phase, we also have tremendous market failures. In terms of access to vaccine, we know now Africa is really in a very difficult spot, and also other developing countries. They simply don't have access to vaccine. COVAX was seen as a major instrument, but because the supply is really limited, there's a ban of exporting of vaccines, and developed country, advanced economy now basically capture most of the vaccines. It's very difficult for developing country, and particularly Africa, to get access to vaccine. And so far, the population coverage, which is people receive one dose, is still less than 3%. Compared with most of the advanced economy is already over half of their population. So that's one thing. The second thing is vaccine hesitancy. Even for settings which they have vaccine access, still the demand is not there, because there's different rumors, different perceptions, on vaccine, which is a long-standing issue, has been a major challenge facing vaccine programs. So that's another sort of issue we really looking into front and center. Now, how do I say your research can help? So I think we need a lot of this type of policy-oriented research, use mathematical model, and to provide evidence. For example, one example we have done in the HMPGP, which is before COVAX, is to look into allocative efficiency, how countries allocate their current resources, and use mathematical optimization model to say, is there a better way to allocate resources in terms of the designed targets? And that followed by the bank's strong point on having policy dialogue with the key decision makers, for example, the deputy finance minister who is in charge of social sector, and have targeted conversation with them using the evidence, has really made a big difference in many countries. In many of the European countries, East European countries, they changed their budget set up right away, which has make a big difference. The human resource issue which you highlight has been long understanding. There's strong imbalance on allocation of manpower across different continents. This is not an issue in one continent, not the issue in Japan, it's in Africa, in South Asia, everywhere. Has been a long-standing issue. More evidence we can provide, that will provide more leverage for us to trigger policy dialogue, to make concrete suggestions. Of course, the current COVID vaccine rollout, we have so many issues. I say there's a huge potential of your research can be converted into some concrete policy type of recommendations, and we can use the bank's convening power to move this agenda forward. I would like to see more of your research result. And while you're speaking, I'm Googling your first paper on the human resource imbalance allocation. I'm looking forward the result of your vaccine work. So basically, in summary, we're keen to work with you. Maybe Norbert's office can guide us. And to really explore how do we convert this research, this matching theory, the mathematical findings into concrete policy issues, which we can influence our operation, but also use them in our policy dialogues with our country counterparts. Let me stop here. Thank you so much.
Thank you very much, Feng. And now we have Anya Sautman, who is a research economist in the Development Research Group, who will give us her thoughts on the presentation. Go ahead, Anya. Thank you.
Hi, everyone. Can you see those slides right now? And can you hear me? I have several screens here in front of me.
All good, Anya.
Great. First of all, thank you so much for having me. I'm really excited about the opportunity to discuss Fuhito's talk and research. As you can see, I prepared a couple of slides, and the reason is that this is a pretty complex topic, and I had a lot of thoughts, so I wanted to make sure I can deliver them in a somewhat organized manner, and I hope I'll get through all the points I'd like to make. But yeah, I'd love to have some discussion at the end. So to start with, sorry, I'm still struggling with my screen arrangement here a little bit, but just to take a bit of a step back, let me start by saying that matching and market design are really, Fuhito's area of research, a really exciting and interesting area. This work was probably pioneered in the 1960s, but it's an active research area today. And part of the reason is this really close connection in this research between pure theory, and this is actually really some amazingly elegant, beautiful theory, and actually highly relevant and practical policy applications. As you might know, the Nobel Prize in 2012 was given to Al Roth and Lloyd Shapley of Gale Shapley fame, for this work because of this connection and really relevant applications. And market design approaches have helped solve some really important policy questions, such as how to assign children in New York and Boston to schools, or how to match kidney donors and recipients, and so on. Before I delve in, I'd like to, sorry, can you see the second part? Before I delve in, I'd like to make maybe one comment, which is important for thinking about this, I think. As you saw in Fuhito's description of the potential for matching midwives to geographical regions, often the theory in this area of research operates by designing matching algorithms. And these algorithms are described in really decentralized ways. You know, there's an application round, and then there's rounds of accepting these applications or holding proposals. And then the final match is realized when everyone has had a chance to make their proposals and make their decisions. But really the implementation of these can be done completely centralized. So there could be a central clearinghouse where, as Fuhito mentioned, you essentially just submit your list of preferences, and then a computer within seconds will deliver you the matching, the final matching, and spit out who will be matched with whom. So why and when in development economics, or in economics more generally, would we need, or in policy, I guess, would we need these types of matching algorithms and central clearinghouses? So from the literature, the markets where these have been particularly successful are markets where preferences are very complex and there are many participants. So oftentimes these were specialist labor markets, such as medical specialists or legal specialists. And what happens in these markets is often that a whole cohort of people enter the market at once, and then there is a frantic scramble to get get people into their preferred jobs. So there are two things at the same time. There is a huge amount of congestion. This is similar to what Fuhito mentioned about matching vaccines to individuals who'd like to receive them. So there's a lot of sort of, at the same time, people are expressing their preferences, trying to find a good match for themselves. So they are searching the market really frantically. People are really worried about not being matched in the end. So they are trying to go quickly through their preference lists and so on. And these types of simultaneous congestion and complex preferences lead to what's called unraveling. Unraveling is when employers, for example, start making offers earlier and earlier and make them exploding offers in order to force applicants they basically try to lock someone in before the market really starts getting hectic. And so these markets are often pretty inefficient because the wrong people are matched with the wrong jobs. So the algorithms that have been developed have some really cool and compelling properties. First of all, I mentioned already, the centralized matching will be much better at identifying best matches quickly and speed up the process significantly. But then the algorithms themselves often deliver matchings that have two really nice properties. The first is stability. Stability means that suppose there's two participants who are matched with other people, no such two participants would ever want to match with each other over their assigned partner. This is what Fuhito called efficiency before. So there's no unrealized gains in this market. And this is obviously really attractive because it means that this market is, the matching is perceived as fair. People will have higher trust in the clearinghouse, participation rates will be high, and so on. And this is actually something that has been empirically shown. This was one of Al Roth's contributions. Clearinghouses for new gastroenterologists in the UK were tended to be much more successful in regions where the final matching was stable over regions where that was not the case. And then the second property that's really useful for implementing centralized matching is what's called strategy proofness. What that means is that it is simply the best for all participants to just state their true preferences. Just say who are the people who, in order, who would you like to match with? And this is obviously really helpful when you try to do a centralized matching, because you can just ask people what they want, and then you can trust that they tell you the truth without having to monitor or try to enforce that they give you their true ranking. So these are all very well known and sort of traditional properties. But I think where Fuhito's research comes in and what's really exciting is that central matching is actually particularly attractive in markets with what he calls in his research distributional constraints. He gave the example of the midwives. Here, an implementer, such as the government, has objectives besides efficiency, such as regional balance, or maybe fairness or diversity, and so on. And in those settings, Fuhito's work has shown that there can be algorithms that deliver what are basically constrained stable matching. They respect these objectives, these outside objectives, but they also make the matching as stable as possible, so to speak. So no one feels like the algorithm is putting them at a disadvantage. And at the same time, these constraints, these regional constraints or other constraints we have that we would like the matching to fulfill, also give us a strong motivation for actually centralizing the matching instead of letting the market play out. So what are possible applications in development policy for such constrained matching market designs? Well, there are actually many World Bank projects that involve allocating scarce resources, such as vaccines, but all sorts of other things, where preferences are to some degree unknown, and there are additional program objectives that the bank or the governments we work with, our clients, have. And so just to give one big example that I think occurs very often, suppose we try to target support programs such as job trainings or public childcare. On the one hand, we would like to allocate them to people who really value them, right? We want to know who wants or needs what and who benefits the most. That's the efficiency part. But then we also want to make sure that the final allocation respects legal constraints, budget and capacity constraints, and so on. To give another example, and this comes directly from my own operations work, think of a problem that many European countries at the moment have, for example, is to try and integrate refugees more into the labor market, and for instance, design subsidy or other support programs to do that. So we have two market sides. We have individuals who are looking for jobs and have preferences over jobs. We have employers who have specific job requirements, such as skills and qualifications, experience, what work hours does the person want to work, and so on. And unfortunately, some of these preferences, some of these qualification needs and so on might put, for example, refugees at a disadvantage. But maybe significantly, employers might also just have biases against refugees. And if they are given the choice between a refugee and a native worker, they might choose the native worker. So as the sponsor of such a program, we would like to obviously make sure that the most productive matches happen. That's the efficiency goal. But we would also like to make sure that refugees or other disadvantaged groups like women, for example, are included in the matching. And this is the constraint we'd like to impose. So what we should probably not do is to fully implement the employer preferences, especially if they are biased preferences. And I'd like to draw a parallel here. You might have heard of the algorithmic bias in hiring problem. Amazon was a famous case. If an AI is looking over resumes and just learns from past hiring decisions, which might be biased, it might simply replicate these biased decisions and never actually explore promising matches. And here the parallel would be that some of these refugees are actually really good matches for the jobs, but employers might never even consider them. So there may actually be long run even efficiency benefits to overriding these biased preferences. However, because if you let the market sort of play out by itself, it might not ever happen that these matches are explored. So this would be this type of learning about your own preferences might be an additional justification for imposing distributional constraints, but it also introduces challenges. And in particular, of course, when the algorithm is constrained in this manner, this will also affect stability in the sense that people feel they are treated fairly and there's no unexploited gains. And then strategy proofness, that is stating your preferences correctly and accurately. And now this leads me to a list of questions. I had a lot of thoughts on unexplored questions in this space. What are potential challenges? What are potential obstacles in particular when we implement these types of centralized matchings in development policy? On the implementation side, I think the biggest concern is probably how complex these algorithms might be. Not all countries have the capacity for the technical implementation and data collection that is needed, but also enforcement once the constraints are imposed to make sure that is actually leaving the assigned match and doing things outside of this channel. There's also a question which markets are actually complex enough or have binding enough constraints to make this huge effort of centralized matching valuable. And then especially with constraints, what I think I would worry about, take your example of midwives and hospitals, right? There are some hospitals in the regions that already have a lot of midwives with open slots, but the algorithm tries to allocate them to a less advantaged region. We do have to worry probably about collusion or corruption between applicants and hospitals who are trying to fill their slots despite what the government algorithm tells them to do. And I think many countries have state capacity to make sure that this is enforced, but some other countries might not. And then I think another thing that came to mind for me is what is the practical risk that participants actually misstate their preferences? So we talked about strategy proofness and how it's the best thing to do to tell the algorithm your preferences, but people might simply not believe that or distrust the algorithm or distrust the implementer of this algorithm. There might be also a pretty high administrative or cognitive burden to do this, expressing your preferences over all the possible options out there potentially. And one example that I came up with is even in the strategy proof mechanism, there is at least a chance, say, take the midwives in India, right? Suppose they tell you their true preferences, the first 5 hospitals that they'd really like to work at, but then just in order to play it safe, they add a few hospitals that they don't think are very likely they would like to work at, but they just sort of retain the option value. And then when they are matched with one of these hospitals, they think again, do I really want to move to another state? Do I really want to do this? So they might try to renege on the match, and surely we will not be able to enforce that people work in a job that they don't ultimately want to take. So that was a bit of a tour de force. Thank you, and I'll stop here.
Thank you, Anya. And we're now into the section on questions and discussions. So I'll kick it off with a question that I have. I know in Latin America, a number of countries have adopted matching algorithms of the schools or to schools. And in some cases that's worked quite well, but it has also led to or faced some important sort of implementation and political economy constraints. So one obvious one is that not everybody, either teachers or individuals applying to schools, have access to the technology that is required, or know how to use the technology that is required to state their preferences and therefore get matched. And then once people, even when they do apply, and as I said, not everybody does apply, and that leads you to the question with what to do with all the ones who didn't apply, people don't understand why they were not matched to their first preference. In some sense, they understood how the system worked before. You stood in line in front of a school, you waited for hours and hours, maybe even days, and then you handed in your application, and maybe you even tried to bribe the school headmaster or whoever was making the decision, but now they just don't understand what the system is, and in a strange way, some people end up perceiving it as more unfair. Somebody has an advantage, it's just that we don't see that advantage anymore. And so I think there are real issues having to do with how you communicate this. And finally, we've also found that there are often interest groups that object to this more impersonal and transparent mechanisms, obviously people who benefited from the previous system. So I guess what I'm asking is, Fuhito or anybody else, if you want to reflect a little bit on these political economy and implementation constraints, what your thoughts are, in particular in low income or middle income settings, and where these, I think, really do can be important. Thank you.
Thanks a lot. So I guess so let me take on Novat's question and part of Anya's question, comments actually. So so I find this to be really important issue. I mean, this issue that there may be sort of misunderstanding to the mechanism or political economy reasons not to sort of follow the mechanism as intended, or even mistrust to the mechanism. So just to give an example, there's a paper looking at actually even the developed country context, developed countries context. So in the paper by Typhoon Somes and Parag Pathak, so they studied the effect of changing the mechanism in schools, like Boston school is a particular example, where the mechanism used to be non-strategy proof, which means some people can strategically benefit. If you are sophisticated and then you can benefit from the sort of glitch of the system. The mechanism changed to the strategy proof mechanism. So, there's no gain by, being sophisticated and strategic. So they argued that this change actually puts some people who are sophisticated into disadvantage indeed, well, in equilibrium. So that's actually kind of consistent with the sort of anecdotes where some parents indeed oppose to the change of the mechanism, and indeed those opposition came from richest families in the region, in the city, who had this parent group where they are they have been discussing how to navigate the system. So that's just one anecdote. But then that's sort of showing that this is an important issue. So I do not have a perfect answer to this. So let me just answer some of them. Okay. So this mistrust of the algorithm. So for example, so when we talked with some people in Japan about the vaccination, so like I said, what we want to do is to get rid of this first come first served system, because that will put a lot of pressure to, for people to make a phone call as fast as possible. So one possible thing is we thought maybe fair is to use a lottery, basically. So, whenever what time of the day you call, it doesn't matter, you enter the lottery and, slot is given by the lottery. So, some people pointed out that, at least in the Japanese context, there may be a mistrust to this notion that the lottery will be run in a fair manner. Okay, you could imagine that that's the case. Then then one way to solve this, as we proposed, was to use something like age, or any kind of like deterministic exogenous variable, essentially, which could be just used as tiebreaker, but not involving the lottery, just because you don't want to sort of have a possibility that this is sort of like mindable. So there are some things it seems that we can sort of do to reduce some of the issues like mistrust by this kind of like use of sort of like a little bit of a technique. Other issues seem to be more difficult, honestly. So about this stating preferences, honestly, when people don't understand or people don't believe in the mechanism. So I do not have a perfect answer yet. So we actually plan to do some study in our class now. So the University of Tokyo recently adopted the geographical. And indeed, this came up as an issue. So some students don't seem to believe that it's study proof. So we are thinking of how to do the intervention to tell whether there's any good communication to sort of like to students to make them believe that it's a fair and study proof mechanism. But that's for another talk in a few years, I guess. Thank you. That's all I have for now.
Thank you, Fuhito. It seems like one of the advantages of using an algorithm, like you say, is that it's potentially an unbiased algorithm, though that doesn't necessarily have to be it so, as Anya pointed out. But I guess my question is, what do you think, or again, this is also to any of the discussants, what do you think about the possibility of actually deliberately including sort of weights in the algorithm itself to favor particular groups? So for example, I know again, in the Latin American context, this was done to have an algorithm that did the best possible matches, but gave higher weights, for example, to teachers applying to very remote schools that were getting very few applications, or giving preference to students from low-income backgrounds when they were trying to apply to certain schools. And I'm just wondering what the experience with that is. What do you know? Maybe Anya or anybody else would like to discuss about that as well. Obviously, it involves some sort of efficiency, equity kind of trade-off, but I'm just interested in what do we know about that, and to what extent do you see that as desirable or feasible?
Let me give a quick answer. And of course, Fan and Anya, please feel free to interrupt. Yeah, so in the matching theory, indeed, this is a very big issue. So in the US, the matching theory has been applied quite a lot in school choice, and in school choice, this is obviously a big issue, right? So, and so there are maybe 10 techniques to take care of it. So one is, like you said, give some points or weights to people from disadvantaged backgrounds. So basically, you can give some points. So let's say when you run the matching algorithm, the schools may rank students according to GPA or test scores, but then you give some boosts to some people. So that has been done. Another way is to give a set aside, basically, sort of like a reservation for some students. So in Chicago schools, for example, there are some seats which are open to everybody, but some seats are reserved for students applying from a certain zip code, basically. So both has been sort of technically, actually, this modification can be done. And more difficult issue, however, is, well, one particular issue which people do not know or answer about yet, I think, is when is it better to use this point boost system versus when it is better to use this set aside reservation type system. There are some papers, for example, which is kind of interesting in that if it's very important to give exact target, then it's better to use set aside. If it's kind of not that important, and it's probably better to still have some flexibility, then it may be actually better to use a point system, because that will give you a chance to people who happen to be really good in terms of GPA and others to get into the school, even if that might result in some imbalance. So this is a bit like analogous to the Weizmann's idea of this, the quota versus price regulations. So, so that's sort of a state of the knowledge, as I know. Yeah, that continues to be very interesting questions, I think.
So just to come in here for a sec, I think one of the biggest challenges that I see if you create, for instance, quota or any kind of basically just a rule for matchings to happen is what I mentioned before, which is that to some degree in places where state capacity is not as high or where the public sector isn't the actual employer, I think there is always this risk that people just go around the mechanism and fill their capacities anyways with the folks they prefer the most. And I can say how it's been solved in the program that I'm working on. Here, subsidies are used that encourage employers to actually accept workers that come to them through this algorithm. But I think this is a really big challenge, because if these employers would like to, they can always leave the algorithm and just hire workers in the open labor market. And I think that's I think in many practical contexts a big challenge that the matching algorithm is just circumvented. Boston schools or New York schools, I think they cannot really go against what they are being told by the city. But I think private employers or even public employers that are not under good oversight will be able to muddle their way through a little bit more, is my guess.
Yeah, I guess I'm still struggling, and this is, I'm trying to summarize or get some points from some of the other questions as well. In countries, if we take a very low income setting, my big question is, how do you apply something like this in a very low income setting where the vast majority of people are not going to have access to the technology, leave alone understand how to use the technology and make sure they get the applicants right? I mean, is there a way, and now I'm just throwing crazy ideas out there, but sort of building a little bit on what Anya is saying. On the one hand, there are these risks of going around the system, but on the other hand, it's almost like you need a two-tier system in which, if you, I mean, I don't know, what do you do when people just can't apply? They can't, and they used to know how to do these things beforehand. They used to know that, you go to the school and you stand in line, or you show up on the first day of classes and everybody gets seated, and that's that. So I wonder a little bit about that. But we're out of time. I want to thank everybody for attending. It was a really useful discussion. I think this is a lot of potential. I think there are there's, as Fuhito and Anya and others were saying, that there's a lot of very interesting literature, both theoretical and empirical, from the US in particular, on these kinds of matching algorithms and how they've been applied, and whether they've improved outcomes or not. My impression is that there's still a lot of work to be done, in particular, as I was saying, in lower income settings, where the constraints are different or there are additional constraints. And I imagine there's both theoretical and certainly empirical work to be done there. So thank you everybody very much, and I look forward to seeing you at the next meeting.
Thank you so much.
Thanks, everyone.
Thank you. This was great.
Thank you. Take care. Bye-bye.
Thank you.
Yeah, everyone.